Thank you, Mr. Chair. I want to start off by saying this meeting is not about Medicare for all, and as hard as others have tried, we are not going to dilute this debate. I want to thank my chair for holding this hearing. The ACA has increased access to care for every stage of children's lives, beginning with improved access to maternity care for better health outcomes for children. As the co-chair of the Congressional Caucus on Women Issues and the Congressional Caucus on Foster Youth, I firmly believe that the well-being of our country's children is of great importance. Thanks to the ACA, the insurers who are no longer able to deny coverage for maternity care and treat pregnancy as a pre-existing condition. I would like to ask unanimous consent to enter into the record a letter from the March of Dimes highlighting how important the ACA is to the health of children and women.
Without objection, so ordered.
Thank you, Mr. Chair. The letter notes that before the ACA, women with high-risk pregnancies could be unable to afford medical help for the rest of the year, and babies born preterm, quote, exhaust a lifetime cap before the first birthday. Mr. Issa, how did the ACA pre-existing conditions protections and on annual lifetime limits change the health outcomes of such individuals?
Absolutely. It's one of the most critical protections in the Affordable Care Act. And really importantly, this is not just for people buying coverage in the marketplace. This is for all of us. For most Americans who are getting coverage through their employers, the ACA banned the ability of those insurers, the ones that your employers are enrolling with, from limiting putting lifetime or annual caps, and in particular for moms who are giving birth to complex babies with complex healthcare needs, they could exhaust their entire benefit for their lifetime in a matter of just a few months.
And just for the record, America and everyone listening, the United States of America is leading in maternal mortality. That's women dying in childbirth. And the fact that we're having a discussion, and if you want to say it's insurance, you can't discuss the insurance if you're not talking about health care, and health care are lives. And so, Professor, if the Trump administration prevails in court, what would happen to these requirements?
Well, all of those caps would be put back in place, meaning lifetime caps, annual caps, no caps on out-of-pocket maximums. You would also have a return to a time in which insurers could refuse to insure you for maternity care.
Before the ACA, only 13% of plans that when life was good before ACA covered maternity care. And women in 11 state capital cities couldn't purchase maternity coverage. Until something changes, the only way that we can continue as a human race is through birth and pregnancies, and it's an insult for us not to provide the care for women who are giving birth. Now, Mr. Issa, is that correct? But insurance are now required to cover preventive services, including maternal health visits, without cost savings. Is that correct?
That's exactly right.
Ms. Burton, you talked about being a mom, 4 beautiful children. Before ACA, you were uninsured for years, except for when you briefly qualified for Medicare during your pregnancy. How important was it for your health as a mother with a pre-existing health condition and the health of your daughter to have insurance during that time?
It was critical. As I mentioned previously, all of my children, all 4 of them were born via cesarean. And so if I wouldn't have had the insurance to be able to cover that, I still wouldn't have come from under those bills. I've had very high-risk pregnancies that were very difficult, and it's utterly necessary that I am there to be able to take care of my children. It's not enough to just have them. I've got to raise them and take care of them.
So my closing comment is that when we talk about ACA, we're talking about for me, such a passion I have for children and women in pregnancy, that we not allow this shade of saying it's ineffective and it can't happen, because the women protecting them, and in this country to say that we're leading in women dying in pregnancy, this is a way for us to address that and reverse those trends. And I yield back. Thank you so much.